Your body has a warning system built directly into your lungs, a silent alarm that has been quietly monitoring your breathing since the day you were born. Most people never notice it is even there until one day they wish they had been listening all along. Deep inside your lung tissue, specialized nerve cells constantly measure how well you are breathing. When something changes, even slightly, these cells send a signal toward your brain. This is your body's built-in early warning system, and learning to recognize its signals could give you years of advance notice before any serious problem develops. The pathway works like this. Stretch receptors throughout your lung tissue detect changes in how fully your lungs expand with each breath. When expansion becomes even subtly restricted, these receptors fire signals along nerve pathways directly to your brainstem, the same region that controls your basic survival functions. Quick note before we begin. This video is for educational purposes only. Always consult your licensed physician about any changes in your breathing or health. If you are experiencing severe breathing difficulty right now, call 911 immediately. These stretch receptor cells are remarkably sensitive. They can detect changes in lung capacity long before those changes become noticeable through obvious symptoms like wheezing or visible breathlessness. This is precisely why understanding the subtle signals matters so much. Your body often knows before you do. Here is the first signal most people dismiss without a second thought. A subtle feeling that breathing requires slightly more effort than it used to, even during activities that have not changed. Not breathlessness, not gasping, just a quiet sense that something requires a touch more work than before. When this signal reaches your brain, it often registers below the level of conscious awareness. Your brain adjusts your breathing pattern automatically without alerting you directly. This is actually a remarkable survival mechanism, but it also means early warning signs can go completely unnoticed for months or even years. The second signal involves activity tolerance changing gradually. A walk that used to feel effortless now requires one brief pause partway through. Most people attribute this entirely to normal aging, and sometimes it genuinely is just aging, but sometimes it is your lungs sending an early signal worth paying attention to. Here is where it becomes particularly important to understand the difference between normal aging and an actual early warning sign. Normal age-related lung changes happen extremely gradually, typically over many years, and tend to affect all types of physical activity equally. An early warning sign from your lung alarm system tends to be more specific, affecting certain activities more than others, or appearing somewhat suddenly rather than gradually over a decade. The third signal is something many seniors notice but rarely connect to their lungs at all, a sense that you simply feel slightly different than your baseline self, harder to describe precisely, but noticeably present if you pay close attention. Here is something important to understand about this internal alarm system. In certain circumstances, particularly with gradual, slow-developing lung changes, the signal itself can become progressively weaker over time rather than stronger. This means the very condition that most needs your attention can sometimes produce the quietest, most easily ignored signals. This is exactly why simply paying conscious attention and tracking changes becomes so valuable. Writing down even small observations about your breathing, your energy, and your activity tolerance creates a record that reveals patterns your moment-to-moment awareness might miss entirely. Now, signal number 5. This is the one most people have genuinely never considered connecting to their lung health at all. The fourth signal involves a measurable change in exercise tolerance that you can actually track over time. If you previously could walk a certain distance or climb a certain number of stairs comfortably, and that capacity has noticeably decreased over recent months, this is your alarm system providing concrete, trackable data. Pulmonologists often recommend that patients simply notice and remember these baseline activities. How many stairs could you climb without pausing 6 months ago? How far could you walk comfortably? These comparison points, even when imprecise, often provide doctors with valuable diagnostic information that formal testing alone might miss. Signal number 5 involves your voice. Your vocal cords depend entirely on adequate breath support from your lungs to function properly. When lung capacity becomes compromised, voice changes sometimes appear before other respiratory symptoms become obvious. Specifically, some people notice their voice tiring more quickly during extended conversation, or needing to pause for breath more frequently while speaking than they remember needing to in the past. This connection between voice and lung function surprises many people the first time they hear about it. So what should you actually do with this information? The most valuable step is simply becoming a more attentive observer of your own breathing patterns and discussing any genuine changes with your doctor during your next visit, even changes that feel too subtle or vague to clearly describe. Doctors have simple methods to assess baseline lung function quickly during a regular office visit, including basic breathing observation and, when warranted, a simple spirometry test that provides objective measurement beyond subjective feeling alone. Consider keeping a simple ongoing log. Note any day where breathing felt notably different. Note any activity that suddenly required more effort than expected. This pattern of observation, even without formal medical training, often reveals meaningful trends over weeks and months. Here is your complete awareness action plan. Pay attention to subtle changes in breathing effort during familiar activities. Track your exercise tolerance and notice any gradual decline. Notice any changes in your voice during extended speaking. Schedule regular checkups, especially if you have any family history of lung conditions. And always discuss observations with your doctor, even ones that feel difficult to describe precisely. Your body has been quietly looking out for you your entire life through this remarkable internal alarm system. Learning to listen to its subtle signals, rather than waiting for obvious symptoms, gives you the priceless gift of early awareness. Breathe easy. Live strong. If this changed how you think about your own breathing, please share this video with a family member or friend over 50 who needs to hear this today. And subscribe for a new video every single week, because your health after 50 deserves real answers.